There we go.
Hello and welcome. GLI Live is back, and for a great reason and a great cause, because it is October. And as all of you know, October is for livers. And so I am so excited to be back with you, our listeners, our watchers, our audience, and with our fantastic guests. And I cannot think of a better person to kick off our October is for Livers series, focusing on liver cancer in particular, than Dr. John Ward. Dr. Ward and I have talked about so many different ways to raise awareness and visibility and action around eliminating viral hepatitis and liver cancer. From how to engage Hollywood to how to engage policymakers, researchers, and scientists. And so I know we'll have a great conversation today. But let me give his formal title, which there are many. So I won't take up the entire episode just giving all of his wonderful titles and accolades, but I would like to. But I want you to know how important this guest is to me and should be to you. Dr. John Ward is the creator and director of the Coalition for the Global Hepatitis Elimination Task Force. He's also been an advisor to the WHO, to the Pan American Health Organization. He's been a former CDC director of the Division of Viral Hepatitis. He advises the African Union. He advises us all. And I'm so excited to welcome him to GLI Live today. Hello, Don.
It's great to be here, Donna. Good to see you, and I look forward to the conversation.
Thank you. So, why is liver cancer important, and how is it different from the other cancers? I know one way is we don't normally hear about it, but why should people be talking about liver cancer?
Well, there are several reasons. Number one, it's a major cause of cancer deaths around the world. Deaths from liver cancer is the third leading cause of cancer deaths globally. That's number one. Number two, the frequency of deaths from liver cancer are rising in the United States. And at a time when most deaths from cancers are falling, deaths from liver cancer is rising, one of the very few cancers which that is happening for. So that's really a concern. And then number three is how the great majority of liver cancers are preventable. So in contrast to other causes of cancer, you can prevent liver cancer, and that's why I'm in this business as someone interested in disease prevention. We have some ripe opportunities to eliminate the causes of liver cancer, and in many ways we're making great progress in that regard.
So this is why it's so important and essential to have this conversation about eliminating viral hepatitis, to sort of pull back from the trends in liver cancer. We can't do that without eliminating viral hepatitis. And so tell us more. I was fascinated when I sort of started in this field that there is A, B, C, D, E. What do people know about the different types of hepatitis?
Yeah. Well, liver cancer most often starts with the liver getting inflamed from a insult, and then gradually from that inflammation gets scarring, and then severe scarring is what's called cirrhosis, where there's just so much scar tissue it's really interrupting the liver's functions. And then because of that inflammation and scarring, you really set up the environment for some of those cells to become abnormal in their growth and leading to liver cancer. Now, the major causes of that inflammation of the liver around the world is viral agents, which are grouped together as viral hepatitis. Now, quickly, they're lettered of A through E, with hepatitis A and hepatitis E being viruses that inflame the liver after they're transmitted by poor hygiene. You ingest some material that contains these viruses, and then they'll flame up the liver. But those viruses will get cleared by the body, and after that initial insult to the liver, which can result in mortality. So they have their own health risk, but they do not lead to liver cancer.
Mhm.
And then they're cleared. And then you're left with hepatitis B and hepatitis C, which cause 96% of all the deaths from hepatitis around the world. And they are more what's called bloodborne viruses. So they're spread when you get contaminated blood under the skin, like through an injection or a blood transfusion, or in some cases for hepatitis B, it can be spread sexually. But what's most important about hepatitis B virus is that it can be spread at the time of birth from mother to child. And once infected, that child has a 90% risk of remaining chronically infected. Then it's also spread among young children when they get exposed to incidental blood, like in households, just very, very minor, like abrasions on the skin, et cetera, can lead to transmission. They have about a 50% risk. And then you have hepatitis C virus, also bloodborne, but tends to be spread through poor infection control practices in healthcare settings and among people who inject drugs because of their poor hygiene. So all of those, and those persist in the body for years, inflaming the liver, scarring it, and then setting up liver cancer. And about 70% of all liver cancer around the world are related to transmissions from hepatitis B virus and hepatitis C virus. And then there's one little hepatitis D virus that requires the hepatitis B virus to replicate or survive in the body. And so we think about B and D together because of that. So that's sort of the sketch about viral hepatitis.
I know I was, tested for hepatitis before my transplant, before I went on immunosuppressants. It was part of the protocol. And before I started on biologics for my inflammatory bowel disease. There was some pushback at one point about testing for hepatitis B prior to induction of chemotherapy, where in an oncology setting where it could flare up. And so, tell us why screening for hepatitis B and other types of hepatitis is so important throughout the healthcare system, because this isn't just something that hepatologists need to know about. This is something that primary care doctors, gastroenterologists, oncologists, all the different parts of the healthcare system need to be a part of screening for hepatitis. Can you tell us a bit more about, why and how that looks?
Yeah, the big challenge for hepatitis B virus and hepatitis C virus infection is that they're very silent for years. The liver is a very stoic organ. It puts up with a lot. And so even though it's getting attacked on a daily basis by millions of viruses being replicated in the liver, and it progressively getting scarred, people will have no symptoms for years. And so you really have to test it to find out if you're infected, and then get the care and treatment you need, which can greatly protect your health and greatly reduce your risk for liver cancer. So testing is key. You cannot wait. If you wait till a specialist do your testing, that means you're probably already very ill from your hepatitis and at high risk for liver cancer already. So we really want to back down to where people tested much earlier in life, much earlier before their liver is attacked so severely that they're developing liver cancer. And that means they need to be tested by primary care doctors, obstetricians, gynecologists, community outreach settings, occupational health. It really needs to be a system-wide appreciation of the risk of hepatitis and what can be done to eliminate it throughout our country and around the world.
Absolutely. I'm going to get to some of the aspects around the world, but I just wanted to follow up a minute. Under your watch, I remember seeing ads in airports. I'd walk through the airport and I would see, posters about screening, particularly older adults for hepatitis C. I don't see those in the airports anymore. Can we get those back in the airports? What would it take to get sort of a renewed energy around awareness campaigns about, viral hepatitis screening, perhaps a little more generally, even than for that age cohort?
Well, we have to, yeah, well, when I was the director of the Division of Viral Hepatitis, and we had these new drugs came out around 2015, the miraculous cures for hepatitis C virus, the first time in the history of medicine that you cure a chronic viral infection, that were released. And then they were rapidly found to be very safe, highly effective, over 90% of people cured after 1 to several pills a day for 2 to 3 months. And very few side effects, very few drug-drug interactions, just miraculous treatments. And then I looked at the trends in hepatitis C in the United States. And there was this, when you look at this line of, we do these line graphs to show the frequency or prevalence of infection by age. There was this faithful bump among people 45 to 65 years of age, and it was like moving through time as they aged. And it was a reflection of the fact that the hepatitis C virus was not discovered until 1989. Before that time, blood transfusions were not getting screened. Infection control or infection or healthcare safety was not as strong as it was then, and that people were injecting drugs, obviously, in the 60s and the 70s, and all of that together made for a high-risk population at that time. And so about 3% of all baby boomers, as we call ourselves, were had been infected with hepatitis C. And then when I looked a little bit further and looked at large commercial laboratory data, found that about half of baby boomers with hepatitis C already had moderate to severe liver disease. So they were already well down the highway toward developing liver cancer. And so I targeted them for the first general population screening for hepatitis C. And fortunately, that got adopted as a national policy where patients should not be paying for this when receiving it for primary care. And we have a very modest budget at CDC, but we did develop a no more hepatitis with an emphasis on the NO, KNOW, and made various creative materials, posters, and the like that picked up. And it was great that I was just in the Atlanta airport a few weeks ago, and that they're still showing those dioramas there, and it's still a great message. I mean, it's baby boomers who are infected are still at the highest risk for having liver cancer, who are hepatitis C. So I just want anyone who's listening to this, you need to, next time you're in to see your physician, clinician, ask for a test for hepatitis C. And we'll get to hepatitis B in a moment, but you don't want to miss, no one should be dying of hepatitis C anymore in the United States. We have reliable tests, we have these curative therapies, they're widely available, and we need to make sure that everybody's receiving that care and treatment.
So, one of the things that, the breadth of your career goes from science to the policy of it all. And so if we stick with hepatitis C for a moment, in an environment where we have tests, we even have rapid tests for it, we have a cure, and as Dr. Francis Collins has pointed out, frequently recently, we could actually save money as a country. So for those for whom that's an incentive, we have that too. And so, why have we not eliminated hepatitis C in the United States?
Well, no, that's right. Just thinking of that moving from science to policy to practice.
Mm-hmm.
I mentioned that the virus was discovered in 1989, or the reporting
Mm-hmm.
of the discovery in 1989, and in 2020, the Nobel Prize in Medicine was awarded to three of those scientists
Mm-hmm.
whose contributions led to that discovery of hepatitis C virus. Um, and so I like to say now's the time to move from a Nobel Prize to a noble cause,
Yes.
turning that good science into good practice here in the United States by making the testing and the treatment available so that that miraculous science can turn into a good health for everyone. And that's where it really comes down to good public policy. That's where it started with
Mm-hmm.
baby boomer recommendation.
Mm-hmm.
Now, unfortunately, because of the explosion of drug use through the opioid
Mm-hmm.
crisis, persons um, injecting drugs, we've had a large increase in young
Mm-hmm.
people with hepatitis C. So now it's recommended that every adult
Right.
receive a test for hepatitis C. So I think so when you think about policy,
Mm-hmm.
government has a role in setting out what needs to be done, and hopefully providing the financial support for that, particularly in the various government health programs and government supported healthcare. But then others need to step up as well. That's why I feel like, the Task Force for Global Health is a 501(c)(3), so we're a community-based organization, as is your organization, Global Liver Institute. And I think we have a key role in raising awareness, continue to bring this in front of policymakers is the one that's important. And policies have to change over time, just as we move from a baby boomer recommendation to all adults,
Mm-hmm.
because the circumstances change, risk populations change, people who need treatment, need testing change,
Mm-hmm.
and so that's the other function of, and then making the public aware, as we're
Mm-hmm.
doing today. Why is this important? Why should I be tested? And so the civil society, has a role in that. Obviously, the various parts of our healthcare system outside of government, um, you know, health maintenance organizations, um, and the like, employers, they
Mm-hmm.
can make available as part of their insurance package, has a role. And then industry has a role by obviously continuing to make these diagnostics and treatment available, and then working with government and health systems to make sure that the cost of these therapies and diagnostics are not getting in the way of people receiving the testing and treatment they need, and benefiting from this good science.
Well, I know that I've, personally promised Dr. Harvey Alter that I would do my best, one of those Nobel Prize winners, that I
Yeah.
would do my best, and that GLI was at the disposal of this cause, of this noble cause. Now, I love that you call it that, of eliminating hepatitis C. It seems, there's so many things that we don't yet know how to do. It seems a shame not to do the things that we do know, and so I am committed to the cause, and so are others. One of the things that your organization has given a platform and infrastructure for is how to do this globally. So can you talk about how some other countries are attacking the same problem?
Yeah, absolutely. When I was directing the Division of Viral Hepatitis, and I saw these immense opportunities coming about because of these new treatments, and we haven't even spoken about the safe and highly effective vaccine to prevent hepatitis B.
Mm-hmm.
I realized these were rich opportunities to advance health around the world. So I moved over to the Task Force for Global Health after retiring from CDC, to learn from their programs for other disease elimination initiatives. And so started the Coalition for Global Hepatitis Elimination, to bring together the key stakeholders of expertise and resources to help countries start and successfully complete hepatitis elimination programs. So you mentioned I work with WHO in this regard, Africa CDC, Europe CDC, and a variety of European and African, Asian, and the Americas countries to see what we can do to assist their efforts. Now, just for the United States, other countries are making great progress in hepatitis elimination. So we, and they vary widely. For hepatitis C, the most remarkable program is in the country of Egypt. They had a high prevalence because of safe injection practices in their healthcare system years ago, and so in some parts of the country, we need 40% of people over the age of 50 were infected with hepatitis C just because of this repeated contact with the healthcare system. So they, as these drugs became available, they put in place a large national program to test every adult, and they made the testing widely available in mobile vans and wherever people were contacting healthcare, and they tested something like 70 million people in just amazing several years, and drove their prevalence down from about I guess it'd be about 1 out of every 20 people infected and all throughout the country, down to about 1 in 50, and closing in about 1 out of every 75 in just about 3 years. And again, they did that with what I call by bringing together the necessary components of an effective program, which is like good information to know how big your problem is, good political commitment to supporting a program, good public understanding of why the program is important and why they should participate, putting in the tailoring the testing and treatment to fit that health system or community-based approaches in that program, getting that going, and then having information along the way to know how well you're doing so you can improve your quality, and then you can document your achievement of your goals when that time arrives. And Egypt has done that in a spectacular fashion. And they're what's called a middle-income country. They're not a wealthy country, but they were able to do something that was fully affordable for them. And then quickly, another country in Africa is Rwanda, a very small country in Eastern Africa, and considered to be a low-income country. But and using money that was made available from the Global Fund, they requested that some of that resources be used to support a hepatitis C program there. Again, a population that had been infected in previous years through unsafe healthcare. And they put together a very robust testing and treatment program, much like Egypt, and they have achieved remarkable reductions in the prevalence of hepatitis C. So just to say that hepatitis C elimination is possible, and it's happening in countries with a lot less economic resources and much more limited health systems than we have here in the United States. So if anything, it should only propel our momentum forward to get the job done here as it's getting done in other countries elsewhere.
I agree. I think we should take up the challenge. And I think it's also important, recognizing liver diseases and liver health as a global problem. It also means that there are solutions that can emerge in all parts of the world, particularly those in Asia and Africa, who have sort of an elevated priority historically around viral hepatitis. There are things that we can learn, and I often challenge our team, does it work in Seattle and Senegal when we're talking about, options, because I really think that the scalability of solutions to communities is really important for us to think through from the initial design of things. And so often we think about exporting, U.S. solutions abroad, and I think this is an area where maybe we need to import some global solutions into the U.S. and put into practice really quickly.
I think that's so on point. That's what I've found here, that there's lessons learned that can be shared in both directions. I mean, clearly, the U.S. continues to do we helped develop the drugs to begin with for hepatitis C, and there's some good programs here. But at the same time, we have to be open for learning from others, because there's some very novel strategies and approaches around the world. And it's just to say what this toolbox of how to eliminate Hep C is full. We have a lot of options to put into place to get this job done. And really, at this stage, it really comes down to some political and public commitment to the effort, because it's fully achievable in this country, and you just need that time and attention that it deserves, that we can really, in a relatively short period of time, put hepatitis C in the rearview mirror as a health threat for our country.
I agree. And I want to give some time to make sure we give some love to our hepatitis B family. I actually wore my vaxxed necklace just to all of them. I have all of them now. COVID and hepatitis B, every vaccination, I have flu shot. But there is a hepatitis B vaccination, and I know people are working on a hepatitis B cure. Do you want to talk about the energy and momentum around those activities?
Yes, absolutely. So there's been a vaccine against hepatitis B since the early 1980s, and we took years to understand how to best apply it. But as I mentioned earlier, infants born to hepatitis B infected mothers are at risk for becoming infected. Once infected, 90% remain infected, and they have a 1 in 4 chance of dying early in adulthood from liver cancer and other liver disease. So it really puts them in high risk. Now, as I mentioned also, infants before the age of 5, just by the way their immune system matures, have about 30 to 50% remain infected. So they're also at high risk of dying of liver cancer in later life. All that to say, it's very, very important to vaccinate children so they don't stay infected. And progressively, over the last 20 years, there has been remarkable advances in improving the number of children getting getting vaccinated as infants. Approaching about 74% of infants are getting vaccinated now to prevent hepatitis B. So that's great. Now, one of the elimination goals, it was like an interim or a goal to see how well you're doing toward your final goal, was to reduce the prevalence of hepatitis B globally among children less than 5 years of age to less than 1%. And by 2020, on the way to making it to 1 in 1,000 by 2030. And by 2019, the data shows that the world achieved that goal with falling below 1%, with large countries like China reporting just remarkable decline. And in fact, when you look, it's been estimated that 22 million deaths have been averted because of a hepatitis B vaccine program since 1990, 22 million deaths. And if we keep improving coverage, we can prevent another 8 million deaths by the end of this decade. Now, the part of the world that's lagging the furthest behind is in Africa, where only about less than 1 in 5 children are receiving this life-saving dose of hepatitis B vaccine right in their first day of life. And so we're all about trying to change that. And we've been working with the various parts of the health ministry to put their policies in place, speaking of policy development, so that they will begin to recommend their infants receive this birth dose in 1 day of life. That's not happening in most countries in Africa. Doing some public relations work to raise awareness among the public, including policymakers, about how bad this problem is and how it could be corrected with hepatitis B birth dose vaccination. So that's really one of our major efforts there. Now, you can, it's also a good opportunity to, as you mentioned, African countries have some of the highest prevalences of hepatitis B in the world. So the 8 to 12% of pregnant women are infected with hepatitis B. So it's a good opportunity to screen the mother to see if she's infected, to make sure that the infant's getting the protection they need. But it's also a great opportunity to make sure the mother is getting the care she needs because of her infection. And as I mentioned, the hepatitis B virus can be spread within households. It's also an opportunity to take that next step and to screen and vaccinate the family, a real family approach to that. So we really are looking at all of that as a way of protecting early, catching the infections as early as possible, so they can get on the hepatitis B medicines, which are not curative, but they do slow the virus from growing in the body and greatly reduce the risk of liver cancer for those individuals. So we're very, very focused on all of that effort to improve infant health, maternal health, family health.
I think that is a wonderful set of takeaways to end on, and it's exactly why, as much as we love our hepatologists, and we do, and our infectious disease specialists, that this is such important information for the obstetricians and gynecologists. So our friends at ACOG, our pediatric folks at AAAP and globally, our family medicine friends at AAFP. I want them to hear this message because these are your patients too, and so we need you. We need their buy-in as part of this to be able to be successful. And so, if people sort of wonder why our net is cast so wide across medical practices, including advanced practice providers. It just came from their conference. And so talking to nurse practitioners, it's because everybody needs to be on board to identify, the pregnant people, the infants, the young children, young adults. Like I was 13 when my liver disease started, working age adults, as well as older adults and seniors. We need identification and services across the spectrum to be successful. And you've just laid that out so well. So I thank you, Dr. Ward. And thank you for this conversation. And thank you for all the work that you do.
Well, thank you. If people would like to know more about the coalition, just go to globalhep.org on the web, and I'm at jward@taskforce.org. If anybody would like to follow up with some additional comments or questions, I'm always available. As my family says, I only talk about hepatitis.
That's fantastic. And we'll make sure that's in the show notes, wherever you find this, whether on YouTube or Facebook or Instagram, or increasingly for the podcast version.
Look forward to it. Thank you. Thank you very much.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.